So before administering oral medications, I want to point out some discrepancies I found on the physician's order and on the MAR. On the physician's order, I would want to question the physician about the order for milk of magnesia for Marsha Brady. And then on the MAR, it says that the patient is to receive digoxin 0.25 milligrams by mouth daily, but that is not actually on the physician's orders. And then I would want to question the physician about the micro K 8 milliequivalent by mouth 2 times per day, because it states that it should not be used if there are severe kidney problems, and on the physician's order it states that the patient has a history of renal failure. And then also on the MAR, procainamide HCl 500 milligrams by mouth every 3 hours was not added, but it is on the physician's order, and so you would want to make sure to update the MAR. And I believe those were all the discrepancies that I found. So, in my next video, I will demonstrate how to administer oral medications. So before administering any oral medications, you would want to verify the MAR has been checked with the physician's orders within the last 24 hours. You would also want to check for any patient allergies. You would then want to make sure that your medication cart has MARs for all patients on the floor. You would then want to make sure that your medication cart is fully stocked, and if it is not fully stocked, you would want to make sure to gather all necessary supplies. You would then check to see which patients on the floor are NPO, which means nothing by mouth. You would also want to check to see which patients are going to be off the floor either for surgery or for other procedures. You would then want to perform any dosage calculations. You would then perform hand hygiene. After performing hand hygiene, you would wheel the med cart to the patient's room. Once in the patient's room, you would remove the patient's medication drawer, where you would perform your first check following the 5 rites of med administration. When you're performing your first check, you want to make sure that when you pull the first medication out, you check it with the MAR, and then you set the medication down next to its name on the MAR, following the 5 rites of med administration, which are right medication, right dose, right time, right route, and right patient, for all medications being administered. You then perform your second check, and instead of placing the medication next to its name on the MAR, you would place it in the medication cup, unopened. I would perform hand hygiene and prepare to administer meds for the next patient.
Nurse, take my cup.
So I've now completed my second check, and I am going to take my medications and the MAR into the patient. Hi, my name is Amanda, and I'm going to be administering your medications today. Before we get started, can I please verify your name and date of birth? Alright. And I'm going to assess for any indications of an adverse reaction from previous doses, which there are none of. And how are you feeling today? You have a slight headache? Alright. Let's see if I can get you some medication for that. So, I have 4 medications for you today. So right now I'm going to perform my third and final check while I'm preparing to give Marcia her medications. The first med is Keflex, which is your antibiotic for pneumonia. I then have Lasix, 80 milligrams, which is for hypertension. I have Procainamide, which is for arrhythmias. And I have Tylenol, 650 milligrams for the headache. So if I could just please have you sit up. And I want to make sure you drink a little bit more. Did they all go down all right? So before leaving the patient, you would want to make sure that they swallowed all medications with no problems and that they had adequate fluid intake. After administering the medications, you would initial next to each dose on the MAR, and you would then sign the MAR. Before leaving the patient, I would return the medication drawer to the med cart, which is done after the second check. I would also make sure that the patient has their call light within reach and that they're comfortable.